Welcome once again to our channel where we prepare you towards your school and licensure exams. Today we are discussing Krok 1 2018 booklet for all Krok 1 medical students. This is actually part 2. If not watched the part 1, kindly check it out and do well to watch it before you continue from here. Now if you are new, kindly subscribe, and if you have already subscribed, kindly turn on the post notification bell so you'll be aware anytime we post any new video. Now let's begin. A 63-year-old man suffers from esophageal carcinoma, presents with metastasis into the mediastinal lymph nodes and cancerous cachexia. What pathogenetic stage of neoplastic process is observed in this patient? Well, cancer develops in 3 stages: the initial, promotion, and progression. Initial is when you put the seed in the soil. Promotion is when the grass starts to grow. And progression is when the grass gets completely out of control, invading the driveway, borders, and pavement. Now, the presence of metastasis indicates a stage of progression. So over here, our answer should be C. After an X-ray examination of the tuberculosis clinic patient, he was diagnosed with tumor of the right lung. During operation, the surgeon removed the middle lobe of the patient's right lung. This lobe includes... Alright. In general, each lung has 3 segments. The upper lobes contain 3 segments. The middle lobe or lingula contains 2, and the lower lobes 5. So bilaterally, the upper lobes have apical, posterior, and anterior segments, and the lower lobes, they have apical, anterior, medial, posterior, and lateral. Whilst the middle lobe on the right has 2 segments, that is medial and lateral. Easy to remember: middle lobe, medial, and lateral. So M, medial, lobe L, lateral. Now the lingula on the left side is part of the left upper lobe, and it is the equivalent of the middle lobe on the right, and hence it has 2 segments, but in this case it is divided into superior and inferior segment. So if this was to be on the left side, we would have gone for superior and inferior segment. So over here our answer should be A. A 2-year-old child presents with physical retardation and frequent pneumonias. The child was diagnosed with non-closure of the arterial canal. Hemodynamics disturbance in this case is caused by the communication between the... Alright. Now, in developing fetus, the ductus arteriosus, also called the ductus botalli, is a blood vessel connecting the main pulmonary artery to the aorta. It allows most of the blood from the right ventricle to bypass the fetus' fluid-filled, non-functioning lungs. Upon closure at birth, it becomes the ligamentum arteriosum. Failure to close after birth results in condition called patent ductus arteriosus and the generation of a left to right shunt. If left uncorrected, patency leads to pulmonary hypertension and possibly congestive heart failure and cardiac arrhythmias and developmental lag. So our answer here should be B, aorta and the pulmonary trunk. That is the connection. A child diagnosed with purulent inflammation of the middle ear was brought to the otolaryngology department. The disease started with the inflammation of the nasopharynx. It was determined that the infection had reached the tympanic cavity through the eustachian tube that is located in there. So we're looking for the location of the eustachian tube. This tube is also called auditory tube or pharyngotympanic tube, which is a tube that links the nasopharynx to the middle ear. It extends from the anterior wall of the middle ear to the lateral wall of the nasopharynx, approximately at the level of the inferior nasal concha. The canal through which the auditory tube passes is called the canal for auditory tube, also known as canalis musculotubarius. So our answer is E. During the pre-start period, an athlete develops increased frequency and force of cardiac contraction. These changes are caused by the intensification of the following reflex responses. Unconditioned, also known as inborn reflex, is an autonomic, instinctive, unlearned reaction to a stimulus. In other words, it's not planned. Conditioned, on the other hand, is an autonomic response established by training to an ordinary neutral stimulus. It is planned. Example, preparing for exams or preparing to run, or athletes. Sympathetic nervous system prepares the body for intense physical activity and is often referred to as flight or fight response. The parasympathetic nervous system, on the other hand, has almost the exact opposite effect and relaxes the body and inhibits or slows many high energy functions. Increased frequency and heart contraction is sympathetic, and that is why our answer is sympathetic conditioned. So A. Due to trauma, the patient has lost 25% of circulating blood volume. Name the emergency compensatory mechanism against blood loss. Alright, so first of all, interstitial fluid flow is the movement of fluid through the extracellular matrix of tissues, often between blood and lymphatic vessels. This flow provides a necessary mechanism for transporting large proteins through the interstitium and constitutes an important component of microcirculation. It also provides a specific mechanic environment that is important for the physiological activities of interstitial cells. With large volume of blood loss through trauma, ischemia and anemia develop, and hence to compensate, this mechanism is employed. And that is why our answer is interstitial fluid inflow to the vessel. ECG analysis of the patient shows that the T waves are positive in the second standard limb lead, and their amplitude and duration is normal. The conclusion can be made that the following process occurs normally in the patient's ventricles. Now, in electrocardiography, the T wave often represents the repolarization of the ventricles. The P wave represents arterial depolarization, which results in atrial contraction or atrial systole. The QRS complex corresponds to the depolarization of the right and left ventricles of the human heart and contraction of the large ventricular muscles. So like I said, T wave represents what? Ray polarization. So our answer is D. A patient demonstrates sharp decrease of pulmonary surfactant activity. This condition can result in pulmonary surfactant is a mixture of lipids and proteins which is secreted into the alveolar space by epithelial type 2 cells. The main function of surfactant is to lower the surface tension at the air-liquid interface within the alveoli of the lung. Therefore, decrease of this leads to alveolar tendency to recede, thus alveolar collapse at end expiration. So our answer is C. After a case of common cold, the patient developed numbness of the right side of the face. Examination revealed disturbed pain and thermal sensitivity to the right half of the face. What nerve was damaged? Now, this is trigeminal nerve, which is actually the fifth cranial nerve. It is responsible for sensation in the face and the motor functions such as biting and chewing, and has three major branches. That is the ophthalmic nerve, the maxillary nerve, and the mandibular nerve. So this is actually not talking about the facial nerve, but it's actually talking about trigeminal nerve. Trigeminal nerve. So our answer is A. X-ray examination of a 57-year-old man indicates local areas of hard bone tissue resorption in some of the patient's bones. These changes can be associated with increased activity of an osteoclast is a type of bone cell that breaks down bone tissue. This function is critical in the maintenance, repair, and remodeling of bones of the vertebral skeleton. The osteoclast disassembles and digests the composite of hydrated protein and mineral at a molecular level by secreting acid and a collagenase, a process known as bone resorption. This process also helps regulate the level of blood calcium. Therefore, our answer is called osteoclast. So that is the process that's involved in bone resorption. Thank you, and I hope you enjoyed it. You can get more of these on Medent app available on Play Store. A link will be given in the description for interested persons. Thank you once again. Enjoy.